A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
America Brecher, do you or someone you love suffer from aching feet or foot pain? Today, 1 in 3 people over the age of 65 has foot pain, stiffness, or aching feet, a part of our body that has nearly 8,000 nerves. In the United States, up to 87% of people have painful feet at some time in their lives. According to orthopedicassociates.org, the average adult takes close to 6,000 steps a day. 6% of the population suffer yearly from foot injuries, bunions, flat feet, or fallen arches. It could be because we walk about 100,000 miles in a lifetime, with over 2 million of us seeking treatment for plantar fasciitis, heel pain, each year. And older people who are living in long-term care facilities tend to have even higher rates of foot problems. On this special edition of your Hometown Health Connection, meet the medical team from Excelsior Orthopedics who are helping those aching feet. America Brecher, welcome to the program. Today we'll be talking to Dr. Dan Keating and Dr. Sean Keating of Excelsior Orthopedics, focusing on foot pain, specifically heel pain, and a treatment called Shockwave Therapy that the doctors call a game changer for reducing and even eliminating foot pain in their patients. Dr. Dan Keating is a board-certified podiatrist who treats surgical and non-surgical foot conditions, including diabetic foot care, dermatological foot problems, fractures, plantar fasciitis, and bunions. Dr. Keating uses a whole-person approach, recommends conservative treatment first, and turns to surgery as a last resort. Podiatry runs in the Keating family. Dan's father was a podiatrist, and his brother, Dr. Sean Keating, who's also appearing today with Dan. Dan Keating's son, Chris Keating, is also a podiatrist at Excelsior Orthopedics. Dr. Sean Keating is a board-certified podiatrist who also treats many foot conditions, including skin conditions, tendon issues, fractures, and more. His approach, like Dr. Dan's, is to treat problems non-surgically whenever possible. Dr. Keating says he's always wanted to be a doctor, recalling experiences with his dad, also a podiatrist, and his uncle, who was a general practitioner. If he was not a doctor, he says he might have been a history professor. Both doctors are particularly excited about shockwave therapy, which has been groundbreaking in treating a number of foot conditions over the last 10 to 15 years, and particularly plantar fasciitis. Shockwave technology uses high-frequency sound waves that are placed directly over the area causing pain to create healing. Many patients become completely pain-free and are able to avoid surgery and painful injections. The podiatrists call it a real game changer for a number of foot conditions. Even more exciting, we'll be able to see the treatment with a real patient as the doctors explain what is happening. All right, so I'm going to start with the first question, and Dr. Dan, this one's for you. Can you tell us what causes what's often described as stabbing heel pain, often caused by plantar fasciitis or heel spur syndrome? What exactly is plantar fasciitis?
Well, plantar means bottom and fascia means ligament, so it's really, in layman's terms, a ligament on the bottom of your foot that becomes inflamed, usually from a mechanical abnormality or an injury.
Good to know, because that comes up as one of the top issues that people deal with when they're looking for a therapy like this to help them with. Dr. Sean, why is it important to have heel pain properly diagnosed, and how do you diagnose it? What are the symptoms?
The most common symptom for heel pain is a patient will come in and say that when they get up in the morning, they're hobbling, they're having extreme pain. There can be a slight reduction in the pain, but as the day progresses, their pain increases. And again, when they sit down in the evening or in the afternoon, they go to get up, they're hobbling again. And it becomes a chronic, unremitting pain that is difficult to resolve without some assistance.
So that's the big difference. Not every so often or once in a while, chronic.
It becomes chronic. Many patients come in and say, I'm limping. I'm constantly limping. And that really triggers concern on our part, because this patient is disabled. Their activities of daily living are extremely hampered, and we need to help them.
We need to improve quality of life. That's what it comes down to.
Yes.
Okay. Yes. Dr. Dan, are plantar fasciitis problems related to faulty structure of the foot or anything else, and what causes that problem?
It's really a combination. Sometimes it's a faulty structure of the foot, whether it's a flat foot or a high arched foot, or it may be related further to mechanics in the shoe wear or lack of shoes. There's so many varieties of different shoe wear out there, and sometimes it causes you to walk differently that can promote the breakdown of the tissue and inflammation of the tissue of the plantar fascia.
So a lot of different things can lead to these symptoms
Yes.
that cause this aggravated, this pain and inflammation.
Yes.
That's tough. We know a lot of people deal with this, right? All right, Dr. Sean, what are non-surgical treatments for plantar fasciitis, such as exercises or other possible interventions for this?
Well, we always recommend the non-invasive treatments that are very traditional for heel pain. Physical therapy, stretching exercises, anti-inflammatory medication, modifying their activities, modifying their shoe wear, insoles and orthotics. So they may be custom, they may be over the counter. And sometimes a cortisone injection is required also. So those would be the initial treatment that we start with. There's a night splint is another night boot that a patient will wear. And all of these are done to encourage calf stretching, which seems to be a key to the success of treating plantar fasciitis.
I think it's good to know that there are these non-surgical interventions, because I think a lot of patients have fear that when they come in, they're going to immediately be told that they need surgery. And it's nice to know that upon a visit, they may actually be recommended something else where they don't have to do that just yet. And it sounds like there are these several options.
Yes, we usually start with more than one on the first visit, depending on the level of pain that a patient will present with, and their comfort level with different options, also affordability of options too. And we typically will go through 6 months of what I just mentioned as our conservative, non-invasive treatment before we begin to say, well, we're not getting anywhere. What else can we do? And this is a viable option, the shockwave therapy.
And that is a great segue, Dr. Sean. So let's talk about shockwave therapy and why you were both very excited about it. I understand that extracorporeal pulse activation technology, EPAT, that's the actual name of the technology, is FDA cleared, and it means that it's a non-invasive procedure on the outside of the body. So that's got to be something patients are hopeful to hear about, right? That they don't have to go into surgery, and that this is yet another option available to them.
Yes.
That's really good for patients to know. Shockwave therapy, that's obviously what people know. They know the technology. It's a little more of an understandable term than EPAT, as we've just discussed. This heals musculoskeletal pain by using acoustic pressure sound waves. Can you describe exactly how this happens, Dr. Dan?
Well, it's really just sound waves, and what happens is at a certain frequency, it'll penetrate into that plantar fascia, that ligament, and it creates micro trauma to that area. And oftentimes, as Dr. Sean had alluded to, that this is a chronic condition, so the body is thinking this is chronic. Now we're switching it to an acute phase, and it sort of tricks the body into sending a message to begin a healing process. And it's again the sound wave and several treatments that trigger this activity, and it's been very successful.
So it prompts a body response.
Yes.
Okay, and it's purposely causing inflammation at the onset, and that does what? I think it helps increase blood circulation. Can you explain from there?
It does. It increases blood flow, and again further creates that body's own healing process without any outside influences other than the sound wave.
So sound waves, right? That's interesting. I think when we hear sound waves, we think of music. This is obviously a very different use and type of sound waves.
Yep.
Dr. Sean, how would you explain to patients to understand the difference in this? You know, I think if I knew nothing about this type of therapy, sound waves is confusing to me.
Many patients might be familiar with lithotripsy, which is used for kidney stones. Well, it's the same technology, but it's a different frequency. It's a little lower frequency than what's used for that. And when lithotripsy first was being used for kidney stones, they noticed some musculoskeletal improvement unexpectedly. And that's where the whole shockwave concept developed, to start using it for musculoskeletal issues. So I would, if they understand lithotripsy, they should understand what this is. It's a shock wave that's going to penetrate in, create some ingrowth of blood vessels, and reduce inflammation and thereby reduce the pain.
So typically we're seeing at start 3 treatments, right? A patient will need 3 treatments, possibly more after that, but they should see some relief or some improvement after 3 patients. Can either of you talk about what you've seen in your patients so far?
I've seen a real wide variety of response. Because it's an inflammatory process, we don't want the patient to take any anti-inflammatories during the procedures, but sometimes people get a fairly fast response within a week or 2 or 3, but they can also be delayed in the response, and it can be as long as 6 or 8 weeks before they really see the true benefits. But it's a very high success rate in my experience over multiple years of using this technology.
That's great to know, because I think people are looking for success rates, right? They want to know, does this work on other people's before they call and want to sign up for it and learn more about it. All right, so what else would you want a patient to know? You know, if we're looking to try and help somebody, obviously your goals as doctors is to help heal their pain, improve their quality of life. What's your elevator pitch to a person who just has had no relief for foot pain so far?
Sometimes when they get to that point where there's no relief, you start to discuss surgery. And over the years of using this has helped me to avoid doing surgery on somebody with this technology. I think the success rate is sometimes even better than surgery. It's probably in the high 80s in terms of success rate when utilized properly.
And Dr. Sean, how about you?
Well, I'll reiterate what Dr. Dan was saying, is that before we had this, our patients we would be telling them their only option is surgery. Surgery has its own set of potential complications, and we can't undo surgery once we've done it, although we may wish if we have an unsuccessful outcome. But this is taking over 80% of our patients out of the surgical arena and permitting them to potentially get pain-free and permanently pain-free. There's significant scientific studies that show permanent success in resolving chronic heel pain using this shockwave therapy.
All right, I think that's great to know. And in terms of the 3 treatments, we know 3 treatments up front. How many patients are you finding need more than that, or they feel good after 3?
I have to say that 99% of people after 3 treatments usually they get the successful outcome that we're looking for. But we offer, if they're not seeing the results, we can offer additional treatments.
It's very individual. You know, after I finish the 3 treatments, my protocol is to have them wait 6 to 8 weeks, come back and reassess where they're at. And if they've got a significant improvement, well, why wouldn't we offer another 1 or 2 treatments? If they failed, then we need to explore other options. But it's very rare that we see failure.
That's good to know, and obviously that would be very individualized based on the patients and their response. All right, I think we've learned a lot of good stuff. I'm excited to see how this works. Thank you both, and when we come back, we'll find out what shockwave therapy is all about after we give you some information on how to connect with Excelsior Orthopedics. If you have muscle, bone, or joint pain, Excelsior Orthopedics offers a progressive approach to care that offers the best options for recovery, including state-of-the-art treatments like shockwave therapy. Go to excelsiorortho.com/shockwave to learn more and also see videos. Excelsior Orthopedics has locations in Orchard Park, Amherst, East Amherst, downtown Buffalo, and Niagara Falls, and Urgent Care Express walk-in clinics in Orchard Park, Amherst, East Amherst, and Niagara Falls. For appointments, call 716-250-6505 or visit excelsiorortho.com. We'll be right back.
To the home run hitters, court hoopers, net servers, and pedal pushers. To reach the top, you have to fall along the way. Luckily, Excelsior Orthopedics has you covered with the right care right away. Sprains, strains, or breaks, Excelsior has orthopedic specialists equipped with everything you need for a complete recovery. From imaging and casting to in-house physical therapy, so you can get back to what matters faster. Learn more at excelsiorortho.com.
Welcome back to your Hometown Health Connection. I'm Erica Brecher, and we are continuing our conversation with Drs. Dan and Sean Keating about foot pain. We're learning all about shockwave therapy today, where our patient, Ellen Krupczyk, has just finished her second therapy. There's typically 3 of these, and we're learning about how it all works. We're seeing it in action. So Dr. Sean, you're performing this therapy right now. What goes into it? What are you doing on Ellen?
Well, I start by examining her foot and identifying the trigger points of pain caused by the plantar fasciitis. That's where we're going to target the shockwave. We're going to work around those maximum points of pain. Initially, we use a less intense shockwave instrument to sensitize the tissue. Then we're going to go with the more higher intensity shockwave to focus right at the points of pain. So the initial shockwave is, there's 3,000 shockwaves to desensitize the area. Then we're going to use the deeper penetrating shockwave with 4,000 shocks. And we were able to complete that today. There's a circular motion that we use going around the areas of pain and trying to penetrate as much of the plantar fascia as we can surrounding those points of pain.
Now, as we've seen the shocks go up in intensity, we hear the sound go up. This is a little noisy, Dr. Sean, so this is something that patients can expect if and when they're going through it, right?
Yes, so during the process of, as long as the patient can tolerate it, we're looking at the patient, we're talking to the patient. As long as the intensity of pain isn't getting greater, then we could increase the intensity of the shockwave. And as we get higher and higher, we're forcing more intense shockwaves in to create that angiogenesis or ingrowth of blood vessels to that kind of diseased, scarred area of the plantar fascia.
And let's talk about that pain. As I understand, we learned all about what this is and how it works. Shockwave is purposely causing some trauma to the affected area, so do patients need an anesthetic?
No, they don't. That's the beauty of this technology. Years ago, the first shockwave machine was done under general anesthetic. It then went to a medium intensity where local anesthetic was required. This one, there's no anesthesia required at all. It does require 3 treatments at minimum, but the beauty is a patient has it done, goes right back to their activities of daily living with no downtime.
So the patient may feel some pain during it, but you're gauging their tolerance for it, right?
Absolutely.
What exactly do they feel? And maybe that's a question for Ellen in a moment, but in your experience, Dr. Sean, what are they telling you they're feeling?
They feel a tapping sensation, just like the sound you're hearing. That's what they're feeling. Now, if you put that on a bony prominence, they would feel it. Mm-hmm. So this is intended for soft tissue, not on bone.
Good to know. All right, so Ellen, I am going to bring you into the picture now, and thank you for being a part of this. Let's start with the pain you felt prior to coming in for treatment. What was it you've been feeling that's been bothering you that prompted you to want to try shockwave therapy?
Originally, it had started as heel pain anytime I get off of a chair, get out of bed, anytime I was just sitting, and it would just be a stabbing, aching pain in my heel. And eventually it got to the point where it got so bad that when I just walked anywhere, it just hurt.
You're at 2 out of 3. What does the pain of actually having the treatment feel like? Can you compare the two? Is this worth it based on how you have felt so far?
Yes. The first treatment was a little more intense. You can't say that the whole entire treatment hurts. It just seems like when you hit certain spots, you feel that electrical zapping. It's tolerable. This time it was a lot more tolerable, and I didn't have as much pain this time coming into it as I did the first time either, so I think that helped.
I think that coincides perfectly with the success rates we talked about, Dr. Sean, where I think Ellen said she was feeling approximately 20 to 30% better. Is that what you would expect after a first treatment? And where do you expect Ellen's pain to go from here?
That is very common for patients. After the first treatment, they can have a couple days of significant pain or the same amount of pain that they had from the treatment. But we want that inflammatory reaction. We're trying to recreate that by doing this to get ingrowth of new blood vessels into this area. And then typically with the next treatment, we'll go from that 20 to 30 to to hopefully 50 or 60, and then finally the third treatment to complete resolution of the symptoms.
Okay, so Ellen, hopefully you are now having a lot of hope going into treatment 3, and hopefully we'll hear how you are in a little bit, and 2 to 3 should hopefully be even a little better from 1 to 2, right?
Yes.
If all goes according to plan.
Correct.
And how are you feeling right now? I mean, was it painful getting it? Is it painful getting it? And what was your tolerance through it?
There were just a couple spots that I felt, and it was tolerable, but I'm not going to say it didn't hurt. It hurt a bit, but absolutely not the whole thing. And right now there's no pain. When you're done, you're done.
That's great. I mean, we want to be transparent with people who are interested in this. Yeah, it hurts a little to get it done, but the benefits outweigh, maybe the 10 or 15 minutes of a little pain to hopefully get relief from foot pain, from heel pain, and that's certainly what we want to see in patients. Dr. Sean, when people are committing their time to this, about how long do the treatments take?
Usually it's 10 or 15 minutes. Some patients, though, have this condition on both feet, so then that would double the time, but typically 10 to 15 minutes.
Okay, so for Ellen, who we saw treatment number 2, that was about 15 minutes. If she were doing both feet, you would double that time.
Correct.
Okay, that's good to know, and that's actually something I didn't think about. In terms of cost, this is 3 treatments up front for a total of $600. So it's going to be $200 per treatment for the first 3. If a patient needs treatment after that, it becomes $100 per treatment after that. Again, that's going to be individualized based on how a patient is feeling, and you and your doctor would decide if you need more than 3. I understand that Medicaid and Medicare do not cover this, but for other insurances, Excelsior Orthopedics will ask for authorization first and kind of take it from there. But my understanding is that this is mostly a cash pay service and reasonable compared to other treatments out there. Have you heard any patients weigh in on cost? Are they comfortable with it? Do they find it reasonable?
I think by the time a patient gets to this, they've spent so much time with conservative management, they're anxious to look at something non-invasive, avoiding surgery, that could potentially solve their heel pain. And the fact that it is an out-of-pocket expense, it's the same nationwide. So the insurance companies nationwide are typically not covering this. Occasionally we will find one, but the majority are not willing to reimburse us for that.
So as we talk about patient experiences, what they've been through and what brought them to this point, Ellen, you're going through it now. What advice would you share with others who may be watching this, who are on their last leg, who are looking for something that can finally work for them?
I had tried so many treatments, and the pain has gotten so bad over time that it's affecting my quality of life. It's difficult to go grocery shopping, to walk through the parking lot. A couple of weeks ago, actually, I avoided going to a second store because I knew I wasn't going to be able to walk through there. You get to a point where there is just so much pain and everything you've tried doesn't work that you're like, I need to do this. I need to spend the money. I need to do this. If there's a really good chance this is going to work, you do it.
So for you, cost didn't matter. You wanted to try something that you knew had a pretty good chance would work for you.
Correct. I didn't want to have surgery because there's not being able to drive, you can't work, you're in a boot, you're uncomfortable. This was the best option. It's non-invasive,
right,
and there's a really good history of success with it.
Dr. Sean, we understanding that insurance isn't covering a lot of this, but it is reasonable. There may be other costs involved. If a patient has gone through other options before this, what might they be looking at before they've reached Shockwave?
And that's very individual on the patient, as well as far as their ability to afford everything, but also on what their insurance can cover. There's of course copays for visits. Physical therapy has its set of copays. Orthotics may or may not be covered. Some insurers do cover it, and if not, there are some out-of-pocket expenses. And nationwide, all of us in foot and ankle care are beginning to shorten the time frame from that 6 months to listening to our patients and trying to work with them on what they can afford. And this could become an earlier implementation of this technology because of its success to reduce some of the costs for patients.
And if that's an earlier option, that could be a cost savings in the long run for a patient who maybe doesn't have to wait as long for Shockwave.
Yes.
All right. Ellen, you've had treatment number 2. You might go home and have dinner and talk with your family tonight. What are you going to tell them about experience number 2?
That it is helping. I've done everything we could think of short of surgery for this. This has been terrible, and this is the first thing that I feel like has actually given me relief. So I think it's worth every penny of it because it's better than surgery. Nobody wants surgery.
What had you tried prior to this?
I've done orthotics, I've done stretching, I've done physical therapy, I wear a night splint, we've done injections, we've done radiofrequency ablation, and everything is, you know, maybe a little bit of relief and then it's right back, if not getting worse.
Wow, so you really are a quintessential patient who has chronic foot pain, and you've tried it all.
Correct.
Ellen, thank you. Dr. Sean, thank you. We want to thank our doctors, Dr. Sean and Dan Keating, for being with us and telling us all about this latest treatment, Shockwave Therapy, and of course our patient Ellen for allowing us to record the demonstration and what the therapy actually looks and feels like on a patient. And thank you to the doctors for all they do for our patients experiencing foot pain here in Western New York. If you have muscle, bone, or joint pain, Excelsior Orthopedics offers a progressive approach to care that offers the best options for recovery, including state-of-the-art treatments like Shockwave Therapy. Go to excelsiorortho.com/shockwave to learn more and also see a video. Excelsior Orthopedics has locations in Orchard Park, Amherst, East Amherst, downtown Buffalo, and Niagara Falls, and Urgent Care Express walk-in clinics in Orchard Park, Amherst, East Amherst, and Niagara Falls. For appointments, call 716-250-6505 or visit excelsiorortho.com. Thanks for watching this special edition of your Hometown Health Connection. Be safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.